Hello, and welcome to the EWC podcast, where we shine a spotlight on the incredible stories and impactful work being done to support breast and cervical health and well-being in our communities. I'm your host, Carmel. In this series, we'll be exploring the Every Woman Counts program, a vital initiative that provides free breast and cervical cancer screening and diagnostic services to underserved individuals. We'll hear from dedicated community health workers, program staff, healthcare providers, and most importantly, the individuals whose lives have been touched by this program. Today, in our very first episode, we're thrilled to be joined by jmetz, our health educator at EWC. Jennifer will give us an inside look at how the program started, its mission, and its impact on community members' health across Los Angeles County. But before we dive in, thank you all for tuning in. Whether you're a healthcare professional, a public health advocate, or someone who cares about breast and cervical health, this podcast is for you. Let's get started. Thank you again so much for joining us, Jennifer. First, can you give us an overview of what the Every Woman Counts program is?
Yes. Every Woman Counts is a statewide program that provides breast and cervical cancer screening and diagnostic services to California's most underserved individuals. So our mission is to reduce the devastating medical, emotional, and financial effects of later stage breast and cervical cancer diagnoses and to eliminate the health disparities that medically underserved low-income individuals often experience. Our program is specifically designed to help the most underserved community. So those individuals who lack affordable quality healthcare services because they're either uninsured or underinsured. And here I'd also like to say that although our program is called Every Woman Counts, it's a little bit of a misnomer, and it's important to know that men, genderqueer, non-binary, and trans folks are included in our services as needed for their own individual healthcare needs. We often find ourselves saying, like, if you have it, screen it.
What are the eligibility criteria for individuals to participate in the program?
In order to qualify for the Every Woman Counts program, individuals must live or be in California. They also must self-report living in a low-income household, which is at or below 200% of the federal poverty level. And they must either not have insurance or have limited health coverage with copays and deductibles that they can't meet.
Can you describe the services offered by the program?
We provide routine breast cancer screenings for individuals who are at average risk beginning at age 40, and that's every year, along with routine cervical cancer screening beginning at the age of 21 every 3 to 5 years, along with all the diagnostic follow-up tests one needs. We also provide services as needed to all of our high-risk patients who would begin screening earlier, and symptomatic individuals at any age, regardless of gender.
How do eligible participants access EWC's screening and diagnostic services?
We have a toll-free automated number that can refer individuals to a local provider based on their area code. That number is 1-800-511-2300. But we also have an online provider locator tool that can be found at http://dhcs.ca.gov/EWC. But perhaps the most helpful resources actually are local team who can provide one-on-one assistance to those who would like a personalized referral. Individuals are encouraged to contact us at the local office, and our number is 323-364-7471.
Where are your EWC clinics located?
Good question. EWC has approximately 1,000 clinics or participating providers throughout the state. And just about 200 of them are located right here in Los Angeles County. These providers are pretty well distributed among the 8 service planning areas. And there's anywhere from, I'd say, 3 to 40 providers within any 5-mile radius.
How do you measure success of the program?
Here in Los Angeles, before the final wave of the Medi-Cal expansion program, EWC was screening approximately 45,000 individuals each year. Again, that's just right here in Los Angeles County. And that's a pretty impressive number. So we definitely would say our program is successful, but really our program's success is reflected in the impact we have on each individual's life. So each person we support along the breast and cervical health continuum, in our eyes, represents a significant achievement that each individual we're helping demonstrates our efforts are making a difference in fulfilling our mission to improve the health and well-being of our community. And that's from perhaps the very first time we engage with an individual through our outreach and education efforts, all the way through their screening, diagnostic, and if needed, treatment support.
What challenges have you faced running the EWC program?
We conduct extensive outreach and education, but we are a very small team and we have to rely on word of mouth promotion. We offer free community workshops and health education classes. We participate in health fairs and at various community events. We collaborate with community leaders at work sites, community-based organizations, housing facilities, faith-based programs, and senior centers, I think, just to name a few. And we do all this to get the word out about just how important cancer screening is and how folks can access free services if and when they're needed. So it's our biggest challenge, basically just promotion and getting the word out. We invite all of our listeners to please help us get the word out about our program. Share it with your friends, your neighbors, your family members, anyone and everyone who can benefit. You can also take this opportunity to book us, to speak to your community or table at an upcoming event. We are available 7 days a week, including evenings and weekends, for in-person or virtual opportunities. And we look forward to those invitations.
Thank you so much, Jen, for joining us. It was so lovely having you on our podcast as a guest speaker. One last question for you is, as we wrap up, is there anything else you'd like to share with our listeners?
I think just reminding everybody that catching cancers early helps save lives. And so when cancer is found in its earliest stages, before symptoms even appear, it is easier to treat. And thanks to early detection and screening and improved treatments, cancer death rates are dropping. So as I mentioned earlier, if you have it, screen it.
Thank you for tuning into today's episode of the EWC podcast. And again, thank you, Jennifer Metz, for chatting with us about what EWC is. We've learned that the EWC program is a statewide program dedicated to providing breast and cervical cancer screening and diagnostic services to California's most underserved individuals. The program aims to reduce the impact of late-stage cancer diagnoses and eliminate health disparities, ensuring that all individuals, regardless of gender, have access to essential healthcare services. We also want to draw attention to valuable resources that EWC has accessible to our community. You can contact the program through our online provider locator tool at dhcs.ca.gov/EWC. For personalized assistance, reach out to the local office at 323-647-4711. Taking care of our health is a big responsibility, and an important part of being alive. Like Jennifer mentioned, catching cancers early helps save lives, and early detection and screening are crucial for effective treatment. Thanks again for joining us, and we look forward to having you with us next time.